Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Neuroblastoma. Introduction. Neuroblastoma is a cancer that forms in your nerve tissue. It usually begins in the adrenal glands, which sit atop the kidneys. It may also begin in the neck, chest, or spinal cord. Neuroblastoma most often begins during early childhood. By the time healthcare providers find the cancer, it has usually spread to other parts of the body. Treatment is more likely to be successful if neuroblastoma is detected and treated early. This program will help you better understand neuroblastoma. It also talks about what treatment options are available. The nervous system. Together, the brain and spinal cord are called the central nervous system. The nerves in the rest of the body are called the peripheral nervous system. The brain is the command center of the body. In addition to thinking and feeling, it receives information and sends orders to different parts of the body. Orders from the brain travel through the spinal cord. From the spinal cord, orders travel to the rest of the body through peripheral nerves. The autonomic nervous system controls body functions that we often are not aware of. For example, we usually do not notice when we breathe or how fast our heart is beating. Part of the autonomic nervous system is called the sympathetic nervous system. This includes nerve fibers on either side of the spinal cord, groups of nerve cells along the nerve fibers, nerve-like cells in the center of the adrenal glands. All parts of the nervous system are made up of cells called neurons. Neurons are nerve cells. They release certain neurotransmitters or hormones that allow them to interact with other types of cells in the body. Neuroblastoma. The body is made up of very small cells. Normal cells in the body grow and die in a controlled way. Sometimes cells keep dividing and growing in an uncontrolled way. This causes an abnormal growth called a tumor. If the tumor does not invade nearby tissues and body parts, it is called a benign tumor. It is also called a non-cancerous growth. Benign tumors are usually not life-threatening. If the tumor invades nearby tissues and body parts, it is called a malignant tumor or cancer. Cancer cells spread to different parts of the body through blood vessels and lymph channels. Lymph is a clear fluid produced by the body that drains waste from cells. It travels through special vessels and bean-shaped structures called lymph nodes. Cancer that moves from one tissue to other body parts is known as metastatic cancer. For example, a neuroblastoma that begins in the nerve tissue of the adrenal gland may spread to nearby lymph nodes. It can then spread to other areas of the body, such as the bones or skin. Cancers in the body are given names depending on where the cancer started. Neuroblastoma is a type of cancer that begins in the nerve tissue. It will always be called neuroblastoma, even if it spreads to other places in the body. Neuroblastoma often begins in the nerve tissue of the adrenal glands. It may also begin in the abdomen, chest, spinal cord, nerve tissue near the spine and the neck. Neuroblastoma most often begins during early childhood, usually in children younger than 5 years. It is rarely found in older children. This type of cancer sometimes forms before birth, but it is usually found later when the tumor begins to grow and cause symptoms. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Risk factors. It is usually impossible to specify the cause of cancer in a person, but we do know what causes cancer in general. Healthcare providers also know factors that can increase the chances of getting cancer. These are known as risk factors. Age is a risk factor for neuroblastoma. This type of cancer is most common in very young children, but it is still rare. Neuroblastoma is sometimes inherited. This means that it is passed from the parent to the child. This type of neuroblastoma often happens at a younger age than neuroblastoma that is not inherited. It can also cause multiple tumors. Not everyone who has risk factors for neuroblastoma will develop this cancer. Children who have no risk factors for neuroblastoma can still get it. Symptoms. Neuroblastoma often does not cause early symptoms. Symptoms may not appear until the cancer has spread. The most common symptoms of neuroblastoma are caused by the tumor pressing on nearby tissues as it grows. Symptoms may also be caused by cancer spreading to the bone. Common symptoms of neuroblastoma may include a lump in the abdomen, neck, or chest, bone pain, bulging eyes, dark circles around the eyes, weakness or inability to move a body part. Symptoms of neuroblastoma can also include easy bruising or bleeding, feeling tired, fever, flat, pinpoint spots under the skin caused by bleeding, high blood pressure, jerky muscle movements, severe watery diarrhea, shortness of breath, swelling of the legs, ankles, feet, or scrotum, uncontrolled eye movement. Infants may also have painless bluish lumps under the skin, swollen stomach, trouble breathing. These symptoms may not be caused by neuroblastoma. Make sure to take your child to see his or her healthcare provider to find out what is causing your child's symptoms. Diagnosis. Your child's healthcare provider will ask about his or her symptoms and family medical history. In some cases, neuroblastoma runs in families. A physical exam will also be performed. This can reveal any lumps or other signs of disease. A neurological exam may also be done. This exam checks how well the brain, spinal cord, and nerves are working in the body. Blood and urine samples may also be tested. Blood may be tested for the hormones dopamine and norepinephrine. A higher than normal amount of these hormones may be a sign of neuroblastoma. Urine may be collected for 24 hours to measure the amount of certain substances. A higher than normal amount of the substances homovanillic acid, or HMA, and vanillyl mandelic acid, or VMA, in the urine may be signs of neuroblastoma. Imaging tests can also help diagnose neuroblastoma. Imaging tests that may be used are X-ray, ultrasound exam, CT scan, MIBG scan. Sometimes a sample of tissue may also be taken and tested. The removal of cells or tissues for testing is called a biopsy. A biopsy is the only sure way to know if cancer cells are present. Many tests can be done on the biopsy sample. The sample of tissue can be viewed under a microscope to look for certain changes in genetic information. Sometimes a sample of bone marrow is taken and tested for cancer. This is done by inserting a needle into the hip bone or breastbone. The needle removes bone marrow, blood, and a small piece of bone. It is called a bone marrow aspiration and biopsy. Rarely, neuroblastoma may be found before a baby is born during an ultrasound. Staging. If your child has neuroblastoma, your healthcare provider will determine the stage of the cancer. Staging is an attempt to find out if the cancer has spread, and if so, to which parts of the body. Stages are usually described using the numbers 0 through 4. A lower number indicates an earlier stage. For many types of cancer, stages are used to plan treatment. For neuroblastoma, treatment depends on risk groups. The stage of neuroblastoma is one factor used to determine risk group. Other factors are the age of the child, test results of blood and tumor samples. There are 3 risk groups to describe neuroblastoma: low risk, intermediate risk, high risk. Low risk and intermediate risk neuroblastoma have a good chance of being cured. High risk neuroblastoma may be difficult to cure. Treatment of the neuroblastoma depends on the risk group to which it belongs. Treatment does not necessarily depend on the stage of the tumor. Many of the same tests used to diagnose neuroblastoma are used to stage it. Other tests that may be done include lymph node biopsy, MRI, X-rays of the chest, bones, and abdomen. A lymph node biopsy is the removal of all or part of a lymph node. The lymph node tissue is viewed under a microscope to look for cancer cells. This shows if the cancer has spread to the lymph nodes. If it has, it can easily spread to other parts of the body. An MRI uses strong magnets to create images of the inside of the body. Your child may receive contrast material to make abnormal areas easier to see. An MRI can show if cancer has spread to other areas of the body. X-rays of the chest, bones, and abdomen can show if cancer has spread to these areas. Treatment and supportive care. The type of treatment used depends on the size and location of the tumor, risk group of the disease, general health of the patient. Treatment for neuroblastoma may involve surgery, radiation therapy, chemotherapy, bone marrow transplant, biologic therapy, watchful waiting. Some combination of these treatments may be used. Surgery is usually used to treat neuroblastoma. Depending on where the tumor is and whether it is spread, as much of the tumor as is safely possible will be removed. Radiation therapy uses high-energy rays to kill cancer cells. It also stops cancer cells from growing and spreading. External radiation comes from a machine that aims the rays at a specific area of the body. Internal radiation uses a radioactive substance sealed in needles, seeds, wires, or catheters. These objects are placed directly in or near the cancer. The way radiation therapy is given depends on the type and stage of cancer being treated. Neuroblastoma is sometimes treated with radioactive iodine therapy, or RAI therapy. This carries radiation directly to the tumor cells. RAI collects in certain kinds of tumor cells, killing them with the radiation that is given off. Chemotherapy is the use of drugs to kill cancer cells. Chemotherapy may be given in the bloodstream through an IV or taken by mouth. It may also be placed into a certain part of the body. Sometimes a combination of chemotherapy drugs is used. Children with high-risk neuroblastoma may have a bone marrow transplant. Healthy stem cells are first collected from the bone marrow. Next, chemotherapy kills off cancer cells in the body. Next, the healthy stem cells are put back into your child's body to rebuild healthy blood cells. Biologic therapy or immunotherapy uses the body's own natural defense system to fight cancer. It involves treatments that boost or restore the immune system. Watchful waiting is closely monitoring a patient's condition. No treatments are given until symptoms appear or change. Sometimes neuroblastoma may go away on its own. Watchful waiting may be an option for low-risk neuroblastoma in infants. There may be clinical trials available for people with neuroblastoma. Clinical trials test new medical approaches and treatments. Neuroblastoma and its treatment can lead to other health problems. It is important to have supportive care before, during, and after cancer treatment. Supportive care is treatment to control symptoms, relieve the side effects of therapy, help you cope with emotions. Supportive care also deals with the pain associated with cancer and its treatments. Your child's healthcare provider or a pain control specialist can suggest ways to relieve or reduce pain. Some cancer treatments cause side effects that continue or appear years after cancer treatment has ended. These may include physical problems, changes in mood, feelings, thinking, learning, or memory. New types of cancer. Talk to your child's healthcare provider about the risk of these side effects after treatment.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Neuroblastoma is a cancer that forms in your nerve tissue. It usually begins in the adrenal glands, which sit atop the kidneys. It may also begin in the neck, chest, or spinal cord. Neuroblastoma most often begins during early childhood, usually in children younger than 5 years. It is rarely found in older children. Common symptoms of neuroblastoma may include a lump in the abdomen, neck, or chest, bone pain, bulging eyes, dark circles around the eyes, weakness or inability to move a body part. Treatment for neuroblastoma may involve surgery, radiation therapy, chemotherapy, bone marrow transplant, biologic therapy, watchful waiting. Some combination of these treatments may be used. Low-risk and intermediate-risk neuroblastoma have a good chance of being cured. High-risk neuroblastoma may be difficult to cure. The earlier neuroblastoma is detected and treated, the more likely are the chances of a successful treatment. Thank you for using Explain.